Having a tooth removed, and particularly a wisdom tooth, can result in quite a lot of pain afterwards, and I'd say it's probably the main reason why people don't want to go through the procedure. Thankfully though, there are quite a few things that you can do to help yourself heal faster and with less pain. Now, if you want to put yourself in the best position possible to recover, this is a long video, but there's about 22 tips, and I promise you they'll be worth it. So I'll start off by saying that pain afterwards is completely normal. I tell most of my patients to expect pain for about a week, but sometimes up to 2 weeks for the more difficult ones. In saying that, there are certain things that you should look out for that warrant you calling the dentist. These things include uncontrolled bleeding, swelling that lasts for more than 3 days and is getting bigger, pain that worsens over the course of the first week, and an altered sensation to your tongue or your face. When you do call them, they might ask you to come in so they can examine you. And on that note, these tips that I'm giving you are very generic. So if there's anything that you're given specifically by your dentist, they trump what I'm telling you in this video. So the first 2 tips are about what you can do before the procedure. So firstly, if the gum is inflamed around the tooth, it's going to mean that the healing takes longer and there's going to be more pain associated with it. To combat this, I'd recommend some anti-inflammatories like ibuprofen taken for a few days leading up to the procedure. The second thing is about how clean the gum is. When the gum isn't clean around the tooth, it means there's going to be more bacteria. The more bacteria there is means that it's going to take longer and there's more pain associated with the healing. Again, to combat this, make sure the area is very clean with thorough brushing. You might also want to use a mouth rinse like chlorhexidine for a few days beforehand. One bit of practical advice after the extraction is to listen to your body. I often tell my patients to let pain guide you as to what you can and can't do. If it's still sore and it hurts when you brush in the area or when you're exercising, then don't do those things. As soon as it starts to feel normal, you can start returning back to normal. The next thing we'll talk about is pain medication and getting started early. There's no point trying to be a hero and putting up with the pain. So stock up before the procedure and treat them like your friends. I give pain relief to all of my patients, and I actually recommend that you actually take the pain relief while you're still numb rather than waiting for the numbness to go away and there to be pain. So you're getting on top of it before it starts. A very effective combination is paracetamol or acetaminophen and ibuprofen. Paracetamol is a painkiller and ibuprofen is an anti-inflammatory, and together they work really well. You typically take it about 4 times per day. Paracetamol you can have up to 4,000 milligrams. Ibuprofen you can have up to 3,200 milligrams. But we normally say 1,600 is as much as you really need. And don't have ibuprofen if you are pregnant. One thing to note with ibuprofen is that you should have it with food because it can cause stomach upsets. Now for simplicity, you can take them both together, roughly 4 times per day, or you can alternate them every 2 hours, which is actually the better strategy. It is a little bit difficult though, because you might have to set up some sort of a schedule just to remind yourself, but it does work better because you're constantly taking some medication rather than having it once and then waiting about 4 or so hours, and then it starts to reduce its effectiveness. Now just so you know, because some patients do ask me, there isn't a lot of research to actually show that codeine is any better than this combination, so we typically avoid codeine. The other thing to know as well is these are a rule of thumb, and everyone's different, so if your dentist tells you something else to what I'm saying, go by what they say. The other thing that I wanted to talk about is how long should you have them for? Well, like I said before, let pain guide you, but if I was the patient, I'd actually want to make sure that I'm going to be pain-free. Pain's not a nice thing to feel, so even if you're feeling okay, I'd recommend still taking the medication for a day or 2 afterwards, just to make sure that you're going to be pain-free. Now, one strange sounding recommendation you might have heard about is pineapple juice. Actually, it has some merit. The reason being is that pineapple juice has bromelain in it, which has been shown to have an anti-inflammatory effect. It also reduces pain, it also reduces swelling. Now, most of the studies actually looked at its effectiveness when you're taking at least 150 milligrams after the extraction per day. And if you're trying to have it from pineapple juice, you're gonna need about 1.5 liters of pineapple juice per day, which is quite a lot to ingest. You might not feel like it. So option 1, you can have a bottle of pineapple juice every single day. Alternatively, you can actually buy bromelain as a supplement. I've got some links below if you would like to do that, and you might want to do some research about it because it's actually got pretty good long-term effects, so maybe it's a good daily supplement for you anyway. One other medication that your dentist might give you is one called Dexamethasone. Hey, super quick, if you're getting something out of the video, please like, share or subscribe. It really helps me out a lot. Alright, back to the video. The literature shows us that after extractions, it's very good at reducing the amount of swelling, pain, bruising, and difficulty in opening. However, not all practitioners do give this out, but if they do, normally they'll give you one right before the procedure and then for 24 to 48 hours afterwards. It might be worth asking about. The most important time following extraction is the first 24 hours. The reason being is that once the tooth is gone, there's going to be an empty socket, which will then fill with blood and a blood clot will form. It takes 24 hours for that blood clot to actually form. Now, if it doesn't, if it becomes dislodged or it breaks down, it can end up leading to something called dry socket, which is very painful. So these following tips are going to help you to reduce your chance of dry socket. The first is to avoid smoking and alcohol. The reason being is that both of these affect the healing and how well that clot actually forms. The first 24 to 48 hours hours is critical, but the longer you can go, the better for the healing. The next thing is to avoid disturbing the area. Imagine that you cut yourself on your arm. If you wanted it to heal really quickly, well, you're going to avoid using your arm and you're going to avoid touching it. It's the same thing with teeth. For the first few days, when you're eating, avoid eating on that area and avoid talking too much because that will disturb the area as well. When you start brushing your teeth, be very gentle around the area and avoid brushing for 24 hours. How long do you have to do this for? Let pain be your guide. When it starts to feel normal, you can start going back to normal. Another thing that can affect the clot is rinsing within the first 24 hours. After the extraction, there'll be a little bit of oozing of blood from the area, which doesn't taste very nice, and it can be very tempting to rinse to get rid of that taste. The problem is that rinsing can dislodge the clot. For this reason, no rinsing in the first 24 hours. If you can taste that blood, rather than rinsing, have a drink of something or have some ice cream to get rid of the taste, but just don't rinse. After 24 hours, you should start rinsing, which we'll talk about now. The next thing to help the healing is to keep it very clean through rinsing after that 24 hours after meals. If food starts getting stuck inside the socket, it affects the healing. And a common finding I have is when patients have to come in afterwards because of pain, it's because the site's really not that clean at all. So the rinsing that you're going to do to start with, so days 2 and 3, it's going to be quite gentle. But as the pain becomes less over time, I want you to start being much more vigorous. Chlorhexidine containing mouth rinses, like the ones that I'll link below, they've been shown to be super effective in killing the bacteria that can affect the healing and also preventing dry socket. The best time to do this is straight after eating. So you'll eat something, put a little bit in a cup, rinse around, try to get it around those sockets, and then you would spit it out. So it's about 30 seconds. The alternative to chlorhexidine is using warm salt water. It's the next best thing. A cup of warm water, a little bit of salt, swish it around. What I'd recommend before you have the procedure done, make sure you have some salt at home, and also you might want to prepare like a 500 ml bottle, just so you've got that for the coming days, just so it's one less thing for you to think about. On the topic of foods, there's 2 things to mention. First, because you don't want to disturb the area and put your jaw under extra pressure, avoid hard things, so stick to soft foods for the first few days. Meal replacement shakes are a great way to get you nutrition without having to chew or disturb the site. If you don't have that, that's fine. Things like soups, pasta, sausages, mashed potato, ice cream, really great way. I'd also recommend preparing it beforehand rather than doing it when you're in a bit of pain. You won't want to. How long do you have to have soft things for? Like I said before, let pain be your guide. The second thing with foods is for the first day or 2, avoid really hot food or drink. The reason is that hot things can actually cause more bleeding, more pain, worse healing. Cold things are better, but if you do want something hot, like to heat up your meal or if you wanted to have a coffee, that's okay, just don't have it warmer than lukewarm. One thing to note about eating is try to avoid rice for the first week or so, because little pieces of rice can easily get stuck in the socket and can affect the healing. The next will be rest and taking it easy. The more active you are, the more blood that flows around your body, and some of this blood is going to go to the site, which causes pressure and pain, and it can also cause excess bleeding, which again doesn't help the healing. It might mean binge watching your favorite TV show for a few days on the couch. Again, how long for? Let pain guide you. Some patients find that ice packs can help after the procedure. Now, the literature isn't very consistent if it does actually work or not, but it can provide a soothing effect. Best way to use it, 20 minutes on, 20 minutes off. If you think you'd like to do that, I'd recommend preparing some before the procedure rather than having to try and find it after the procedure when you're already in pain. For more difficult procedures or just in some circumstances, we might give you antibiotics. We don't do it often, but if we do, make sure that you finish the entire course. If you don't, it can contribute to something called antibiotic resistance, where the bacteria don't get completely killed and they come back stronger the next time and the next antibiotics aren't actually effective. On a side note, if you do have antibiotics, just know that it can mess with your gut microbiota, and it might be a good idea to have some probiotics as well so it doesn't disturb that too much. One thing you might notice is bleeding afterwards. Now, it's pretty common for that to happen within 24 to 48 hours afterwards, and it can mix with your saliva and feel like there's a lot there. However, I don't want you to actually do these next ones unless you've got a lot of bleeding, otherwise you can disturb the healing even more. Now, what is a lot of bleeding? Well, I'm talking about when the blood is actually continuously coming out and it's pooling with your mouth and you feel like it's a lot. If you know, you know. The first thing is that your dentist might have actually given you some sterile gauze to take home. If they did, get one out, wet it under the tap, bite down onto it for 30 minutes. The reason you need to wet it is if you put it in dry and then take it out, it can pull that clot out, which we know we don't want to do that. If you find that's not effective, you can actually try the exact same thing with tea bags. Reason being is that tea has tannic acid in it, which can help stop the bleeding. If you don't have any of those things, just get a handkerchief, wet it, bite down onto it for half an hour. If it is still bleeding a lot after 24 hours, it's a good idea to go and visit the dentist. Now, on a side note, with bleeding, probably not a bad idea to put a towel down on your pillow, because when you're sleeping at night, you can get some drool out of your mouth. You don't want to ruin your pillow. Because you're going to be leaving the procedure numb, be very careful not to accidentally bite your cheek or your tongue. You won't know that you've done it until the numbness wears off, then all of a sudden you'll be very sore. For this reason, if you are going to eat something, be very careful and just make sure it's not too hard, because you might do some damage. The next one is about work and timing and how to juggle all of that. It's hard to give you a blanket rule because every person and every procedure is different, and how long you need off depends on how sore you're going to be. As a rule of thumb, the more difficult the procedure is, so if you've got a tooth that's on its side, it has to be cut away, bone has to be removed, or if you're having more wisdom teeth removed, typically means you're going to be in more pain, but not always. I'd probably recommend two things from this. One, have the surgery on say a Thursday or a Friday, so you've got the weekend to recover. The other thing is to preempt that you might not be able to work next week and ask for a medical certificate giving you a week off. Best case scenario, you don't need to use it. Worst case, Monday comes around, say, hey, I've got a medical certificate, I won't be able to come in until Wednesday, you're good to go. The next one is about timing it with your menstrual cycle. Interestingly, the research shows us that if you're in the active period of your oral contraceptive or you're in the middle of your menstrual cycle, you're actually more likely to have dry socket. The reason being is that we think that it's because of molecules that are in your blood system which destroy the clot a little bit faster. This can be quite difficult to actually manage because if you have a toothache, it needs to come out today. But if you can, try and schedule it on a day when you're not on your active pill and you're at the end of your cycle. The last tip is, if possible, have someone around that you can count on to help out. Because you're going to be in some pain, you're probably not going to feel like cooking a meal or preparing yourself some food. You probably just want to be watching TV. For that reason, if there's someone that you can call or if there's someone that you live with that can do those things for you, it'll be a big help. So let's summarize. Call the dentist if you're worried, follow their instructions, reduce inflammation before the procedure, ensure the gum is really clean around the tooth before the procedure, let pain guide you afterwards, use medication like they're your friend, bromelain from supplements or pineapple juice, take adjunct medications like dexamethasone, take at least the first 24 hours seriously to help healing, avoid alcohol and smoking for as long as possible, don't disturb the area, no rinsing for 24 hours, after 24 hours rinse after meals to keep the area clean, soft food to begin with until the pain subsides, avoid hot food and drinks at the beginning, rest and take it easy, ice packs can be helpful, finish the course of antibiotics if you are given them, use gauze or tea bags to stop the bleeding afterwards, be careful not to bite yourself when you're numb, allow for time off of work and ask for a medical certificate, timing it with your menstrual cycle where possible, and have someone close by that you can use to help you out. So there you have it. Like I said, there's a lot of tips, a lot of things that you can do to actually reduce your pain. I guarantee that if you do most of these, you're going to be okay, won't be as bad as you think. If you did like the video, please like, share, subscribe. It really helps me out a lot. Send it to a friend that might be going through the surgery so they can be prepared and it won't be as bad as what they were thinking. If you have any questions, put them in the comment section. I'll make sure to get back to them. Have a great day and keep on smiling.